Hello and welcome to Real Menopause Talk. My guest today is Dr. Ron Eaker. Talking to him is like a breath of fresh air. I know many of us have had experiences with physicians that just leave us flat. This is different. He has a profound knowledge and understanding of and appreciation for women. He wants us to fully understand our bodies and take a holistic approach to feeling good, not just fixing things and accepting adequate, but actually good. In this episode, we talk about the starting point of expectation that peri through to post menopause is natural, normal, and inevitable, but the symptoms are not and can be managed simply. He shares his approach to weight management and sex drive and how he likes to help women live their happiest, healthiest lives. And for once, it's not my dog barking in the background.
Good morning.
Good morning. How are you?
Good.
Dr. Ron Eaker, it is fantastic to meet you. Thank you very much for joining me today. Would you like to start by telling everybody a little bit about yourself, your background, for example?
Sure. I'm a practicing board-certified obstetrician gynecologist in the States for about 32 years now. I'm also board-certified in bariatric medicine, which is the medicine of weight management. And actually, I live in a world of women. As you can imagine, in my practice, I see women every day and have for the last 32 years. In my bariatric practice, I'm probably 99% female. I have a beautiful wife who's a woman. I have two children, both girls. I have a grandbaby who is a female. In fact, the other day, I just figured out that my dog and my goldfish are both female. So I live in this estrogen envelope. So I think that alone gives me a little bit of legitimacy in talking about some of these issues, but it's a real blessing, and it's been a wonderful 32 years, and I hope it continues for many, many more.
Oh, I agree. I hope it continues for you. Yeah, my husband would have sympathy with you or maybe, it doesn't have to be sympathy, fully female household, pets, daughters, myself.
It is a joy.
So what made you in the first place decide to specialize in women's health?
It's interesting. When I first began in my medical school training, I really felt like I wanted to go into family medicine. I had this image of the country doctor going and making the house calls and really getting to know patients and understanding the whole holistic nature of their health care. And then as I got into my training, I realized that with the explosion in medical knowledge, that I really felt like that I wanted to specialize. I wanted to really narrow my focus so that I could become an expert, that I could really contribute. And then I spent my first night on call as an obstetrician rotation and got to participate in a birth. And that absolutely transformed my thinking. I had become very comfortable with the mechanics of birth, but this experience really reinforced the miracle of birth. And from that moment on, I was hooked. And that's really what started that journey, was that experience and that understanding of the incredible gift that we have and being able to bring about such a miraculous event on such an everyday basis. It's hard to label something miraculous that occurs so commonly, but when you think about the biology and how it really occurs, it truly is miraculous. So that's where it all started. And my interest in menopause in particular really evolved later in my career. After being in practice 10 or 15 years, I began to see a lot of women who were coming in and asking a lot of questions that, quite frankly, I couldn't answer. And it really stimulated me to seek answers and to dig deeper into this idea of what was going on during this transition. And as I was growing older in my own practice, I was seeing my patients grow older, and it was just a natural transition. And when I stopped obstetrics, I really focused on menopause, the perimenopause, post menopause, and looking at those issues and trying to bring some clarity into the medical field where there was a tremendous lack at that time also. And so that's what really got my interest in menopause. And that's now for about the last 15 years has been the focus of my practice.
What was it that you saw so often or saw the most that then really piqued your interest in pursuing finding out more about peri to post menopause?
Well, I think I've always been a student, and the patients have been my teacher. And as I listened to them and as I began to understand some of the problems that they were facing, it became clear that a big part of the issue was just education, just learning what was normal, what was not. Folks would come in, and one of their biggest complaints was just, is this okay? Is this normal? Is this supposed to happen? Am I falling apart? That was one of the most common terms that is used in the States to describe this transition is, am I falling apart? Is there something wrong with me? And they were really desperate for answers, and they weren't getting those answers in a lot of the traditional avenues. So that's what really sparked my interest in understanding that people will make good decisions about their health and about their needs if they have information. And I think that's where it begins. It all begins with that understanding of not only what's going on, but what options are out there. And I think that especially applies to menopause because, as you know, when dealing with the women you deal with in your audience and the folks that you've had on the podcast, this is a relatively recent phenomenon that people are actually talking about menopause.
Yeah.
For so many years, it was almost taboo. It was something that wasn't even discussed. I think back to my own family, and I think of my mother. I don't think that was ever a topic that ever was discussed. No, certainly not with her son. But I don't even remember hearing her discuss it with other friends. And I think that's a consistent experience, not as much now, thanks to people who are becoming more vocal about it, and podcasts like this and other avenues that people are gaining insight and are understanding. It's okay to talk about it. In fact, it's essential to talk about it because it's only through that avenue, only through that ability to communicate with people who may be sharing similar experiences or having the same kind of problems that women are beginning to understand, well, wait a minute, this is a normal, natural transition, but it can be fraught with potholes, and there can be difficulties along the way. But the very first step is just understanding what it's all about, what is happening. There's a tremendous power that comes from that knowledge, but it can't stop there. And that's one of the big proponents that I'm a big proponent of taking that knowledge and putting it into action. I think that's one of the key factors when we're dealing with not only menopause, but any health issue, quite honestly, is being able to take what information you have and then put it into a plan that then you can utilize to get you to whatever direction you want to go. And I think the other thing that's so exciting about women understanding more about perimenopause and menopause now is exploding the myths that seem to surround menopause that actually in many ways are quite damaging. I think if women really do understand that the majority of folks breeze through this time frame with really minimal discomfort. I think one of the biggest problems I've faced with my own patient population is almost a predisposition, almost a self-fulfilling prophecy of this expectation that this is going to be a very difficult, trying time. Now, granted, not discounting the intensity of symptoms and the problems that women can face during this time frame, but I think it's important that you begin the mind connection in viewing this as a normal, natural transition. If that's your default, if you begin at that place that this is just another season of life, this is just another change, literally the change, and it doesn't necessarily have to be problematic. Even if you're symptomatic, even if you're having hot flashes that could light up New York, even if you're having sweats like Niagara Falls, it still can be managed, can be handled, and you can really blossom and really find joy in this transition, in this season of life. So I think that's the core of what I do. I consider myself almost more an educator than a physician. And I think really, truly, those are those should not ever be separated. I think those are critically complementary tasks that have to be performed, whether you're a healthcare provider in any setting, is helping folks to understand what's going on in their bodies. And very much like you do with your background and the kind of things that you do with nutrition and yoga and the personal fitness.
Thank you. First of all, I would like to acknowledge what you've said, because I feel that with the talking about it, which is essential, there is almost a tendency to catastrophize about it at the moment, maybe because it's early on in education. Do you find, though, on the positive side of it, that many of your patients are better educated than perhaps they used to be a few years ago?
Oh, 100%. I would agree with you completely. And that's a great description, the catastrophizing that we all tend to fall into in many ways. It's almost the default for many of us. But you're exactly right. There's been a big transition. And I would, just in my own practice, I would guess in the last 7 to 10 years, it has really changed as far as not only learning about menopause, being willing to bring it up in a setting where we can address it. For many years in the beginning of my practice, it would be something that I would have to make a point of addressing, asking questions very pointedly about their particular experience. If I had a woman come in the office and she was in the average age range, the 45 to 55 age range, where we can expect the majority of folks experiencing symptoms, if they were, then I would pointedly try to draw out where they were, what they were experiencing, what kind of problems they may be having, because largely that was not something they would voluntarily discuss. It was not something that was brought up. And that could have been from lack of education. It could have been from a sense that this was just the way it was, and it was something I had to live with, and there was not anything that could be done about it. And that's really where things were 20, 25 years ago. But in the last 7 to 10 years, I think the awareness has skyrocketed. I think whether for good or bad, with the large studies on hormone replacement therapy and some of the publicity and notoriety that surrounded a lot of those issues, that has stimulated a lot of thought and a lot of talk and a lot of discussion. So I think it's opened the doors. Now, with that, it's a double-edged sword, because with that, not only do you have people much more aware, but there's also a lot of misinformation out there. Mm-hmm. If you Google anything related to menopause, you're going to see several thousand, if not millions, of pages of different information about menopause. And unfortunately, the majority of times when you're going that route, you're going to land on someone who's selling something or promoting a particular agenda. So with that increasing awareness and that increasing education, you have to be a very critical consumer. You have to do your homework. You have to have, well, like I do with, and a lot of people do with their financial well-being. You could go down many, many rabbit holes thinking about financial planning. Should I buy this stock? Should I invest in this 401k? Should I do this retirement plan? It's very easy to almost become stagnant because of the wealth of information. So I have 2 or 3 very trusted sources that I vetted, that I understand, that I know have my best interest at heart. And I pay attention to those and relatively little else. Well, the same thing really in my mind should apply to not just menopause, but almost all aspects of your health. I'm all for people learning about their bodies and learning about their needs and their health and investigating it and doing everything they can to increase their knowledge level. But they need to be very circumspect about what they ingest and just have 2 or 3 sources. Hopefully the healthcare worker that you're, whether it's your physician or nurse practitioner or whatever the interaction is, that's one of those trusted sources. And then have a couple of others that allow you to cut through some of the noise and really focus on information that you can feel is trusted, because it's very, very easy. And I hear this from my patients every day. It's very, very easy for them to say, have a symptom, hot flash. We'll just pick that. And they'll go online, which is the typical way that people now are gathering health information. Go to Dr. Google and put in hot flashes. And golly gee, if you've ever done that, it is a rabbit hole. Mm-hmm. You can spend hours and see everything from horny toad venom to who knows what as treatments for hot flashes. So it really behooves you to have trusted sources that you can rely on that can really separate the wheat from the chaff.
Good old Dr. Google, the one that we definitely shouldn't go and see, but it is tempting just to try and get a grip on things sometimes.
You could end up with scarlet fever if you go there and put your symptoms in. It really is one of those wonderful tools, but it has to be vetted and it has to be really looked at with a critical eye.
Oh, absolutely. And depending on what you want the outcome to be, you could either be diagnosed as being pregnant or dead, depending on what you put in.
It's not very individualized. We'll say it's a rather broad swath of advice.
And menopause is incredibly individual. Yes, there are the hero symptoms like hot flashes and night sweats, even weight gain, but then there are the sort of slightly less usual or less heard of ones as well. And it depends so much. Some people never experience a hot flash. Some people are consumed by them. There's no predicting which way it's going to go. As far as weight gain is concerned, I know you're a master of this. How do you approach one of your patients when they say they're struggling with that in particular?
And that is an incredibly common issue in the perimenopause and postmenopause. I really start with a point that you just made that I think is absolutely critical, is that it's so individualized. And the whole menopause experience is you can't cookbook any of this. It has to be really brought back down to the level of the individual. That's what's so key and so important for everyone to remember is, what Aunt Sally did for her problems may not necessarily work for you individually. And that certainly applies to weight. When I think about weight during this time frame, it really is the perfect storm because there are a number of factors that come into play that potentially can work against a woman with regards to her weight gain. The average woman during this time frame will gain anywhere from 2 to 3 pounds a year. That's the average. And there are a number of factors, and hormones play a role, but not probably as much as people anticipate. But there's so many things that go on during the midlife. Certainly age, we know itself has an effect on weight management. We know that as you age, your basic metabolic rate will decrease. That's just part of the physiology. And there are ways around that. But we know that if you do nothing to counteract some of these changes, then that weight gain can be somewhat inevitable. That's the default. And that's why it's so important that you have a plan and are intentional about what you're doing. So age plays a role. Certainly, we know hormones do play a role. It's very interesting. We're learning more and more now about both the natural change with the decline in estrogen and progesterone and the relative change in testosterone. That's one of the hormones that oftentimes kind of gets left aside and not talked about a lot when it comes to menopause. And oftentimes testosterone can be one of the hormones that can influence weight gain because it's an anabolic hormone. It's a hormone that is typically associated with muscle mass, but it can also be associated with accumulation of fat mass. We know that as the estrogen and progesterone declines, oftentimes the testosterone stays relatively stable. But what happens then is you get a change in the ratio of the testosterone to the estrogen. And that sometimes is what can trigger some weight gain. We also know that estrogen is a bit of an appetite suppressant to a degree. And we've seen that in studies that look at estrogen replacement, even though, especially with bioidentical estrogen, is that you can see a bit of a decreased appetite when women will start on estrogen, especially the bioidentical. So the lack of estrogen during menopause can, for some women, trigger increased hunger, which obviously can potentially increase weight if that's not balanced. We also know as you age, for some folks, your activity level can decrease. And there's no question that that plays a role. Weight management and weight gain and weight loss is an incredibly complex problem. And it's not simply calories in and calories out. But we, again, can't remove and eliminate the physics. There still has to be a calorie deficit at some point, and you can achieve that in many ways. But the things that happen during natural aging and menopause, stress. I mean, we know this is an incredibly stressful time for a lot of people. It's a perfect storm with kids leaving and sometimes kids coming back, and changes in life seasons with work, and there's just so many changes that are occurring. Stress is a marked influence on weight. We know that when we're chronically stressed, we produce excess cortisol from our adrenal glands, and cortisol is notorious for turning off the fat burning enzymes and turning on the fat storage enzymes. So we know we're never going to eliminate stress, but we always want to try to mitigate the impact it has on our physiology. And that's one of the things that we really pay attention to. Another very important point is these menopausal changes don't happen in isolation. These things occur in context of what else is going on in a woman's life. We also know sometimes sleep can be an issue during the menopause. And anyone who works with folks on weight understands the incredible importance of sleep and how that can impact things like ghrelin levels, which are responsible for hunger. And a woman who gets a poor night's sleep will literally wake up hungrier because her ghrelin levels are elevated. So that's just an illustration of the multifactorial nature of weight gain in particular, and how many of these things come into play. And if you're only focusing on the hormones and you're wearing what I call hormonal blinders, it's very difficult to see the big picture, and you can't forget about these other things that are having such an influence. I make sure that whenever I'm seeing someone for weight management who's in this age group, that we spend most of our initial evaluation just talking about her life and talking about what's going on in her life and what her goals are and what her dreams are and what she's experiencing now, and what kind of barriers that she perceives, and really understanding not just her physical health, but her mental and emotional state, and understanding what other factors, like oftentimes people in the midlife may have other comorbidities. They may have hypertension, they may have diabetes, and they may be on medications that also have an impact on weight. So I hope your listeners are understanding that there's a lot that goes into that during the midlife. And that's why it's so important, I think, to work with someone who can look at the big picture and really understand them really in a holistic fashion, because I think that's truly the only way to try to make it permanent when we talk about weight loss and weight control. It's a lifelong issue. It's not something like a diet that you just go on and go off. I always start with the premise that this is something we're going to be working with from now on. Mm-hmm. So I want you to get that long-term mindset. If you go into a weight management program with the idea that this is going to be 2 or 3 months, you're going to achieve your goal, and then you're going to move on, that's a big mistake from the outset. That's why 98% of people who lose weight will gain it back, because they have that mindset. So at the very beginning, I try to shift their thinking towards this is a long-term effort. This is something I'm setting my goals along the way, and I'm celebrating those victories. But I understand that this is something that I'm going to be working with for the rest of my life.
That is so refreshing to hear, because certainly the experience of many of the people I've spoken to on the podcast, and my own experience, when we go to a physician that is not the approach that is taken. It's more, right, well, we'll fix X, Y, and Z. But if we're embarking on this life phase and we're going through it anyway, then we may as well take it into account as part of the rest of our life and lifestyle as well. The fact that we begin to lose muscle mass as we age. So changing exercise and beginning to lift weights will also, because muscle is more metabolically active, have an impact on weight. So that's something that I feel a lot more people are aware of now, but it's still getting them to understand and not be afraid of setting long-term goals. And going back to your point that it is emotional and mental as well, very often the whole picture needs to be taken into account. The mental and emotional side of sex drive and libido, how do you start to handle that? Because the loss of libido at this time is another thing that women sometimes find hard to talk about, but also it needs addressing for a healthy rest of your life.
100%. I would agree. Absolutely. And that is close to one of the most common issues that I deal with because it is such a underserved area. And that really, probably more than almost any other symptom, is still somewhat in the closet, if you will. Mm-hmm. There is still a pervasive thought that that is just what happens when you age, that it's just natural to see this sex drive off and even your GPS can't find it. So that's what the expectation is for many women in this time frame. And nothing could be further from the truth. And just like weight, the libido is a very complex emotion, a very complex drive that is incredibly individualized. And it's a little different than a lot of other symptoms because in most instances, it's going to involve two people. Mm-hmm. And that's a very different animal to deal with because if you're having hot flashes, yes, maybe your partner is disturbed at night and they don't get as much sleep because you're up. So yeah, okay, it involves two. But when we're talking about sex drive, libido, sexual appetite, that really is much more involved. So that adds a bit of a different twist to our approach also. But it all starts with education, all starts with looking at the various things that we know can influence libido. And again, just like weight, and I hope this consistent message is coming through that many of these issues have multiple factors that impact that. Just like weight, libido can be influenced by where you are in life, your mental health, your emotional health, your belief system. Certainly, there are some physiological changes that are very common in the menopause that you would think you would make the link very closely between something like vaginal dryness or vaginal atrophy and libido. But oftentimes, folks don't make that connection. If there's any dryness, any pain, any discomfort, which is very common in this time frame, then it's only natural that you're not going to really be very anxious about doing anything. If there's a lack of sensitivity in the tissues, again, which can occur, or normally in the premenopause, the vaginal cell layers are maybe 14, 16 cell layers thick. There's a large subdermal layer that produces a lot of elastin and a lot of lubrication and moisture. Well, in the menopause, you begin to see that decrease because those tissues are very estrogen sensitive. Those tissues are very proliferative based on estrogen stimulation. So if the estrogen declines, those tissues change. And the most common side effect, if you will, of that change is dryness, discomfort, pain with intercourse, decreased sensitivity, changes in orgasmic response, a lot of things that can go on that can influence libido. And unfortunately, a lot of women will say, well, gee, that's just what happens. And I just have to live with it. I have to put up with it. And that's very unfortunate because there's a lot we can do about that. And there's a lot of interventions. And for many women, that's the key factor. If you can change the physiology, if you can change how it feels, then that in many cases will solve a lot of the problems. But again, you can't look at it in isolation. You have to look at the relationship. That's one of the big areas that I always have to discuss and feel very important that we talk about communication. We talk about what is the relationship with your partner right now? What's going on? Oftentimes we hear that the bedroom is a reflection of the quality of the relationship. And in some cases, that's the case. So it's very, very important from the very start that lines of communication are constantly open. It's very easy to have a lot of misperceptions and miscommunication that can sometimes create a rift that can then fester and become even larger. There's a lot of confusion sometimes between partners if the discussion is not had about how they feel about each other. One partner may feel that there's a change in their physical attractiveness when it's simply related to stress at work, and unless that's discussed, that's as important as any physiological change. So the first step in any working with anyone is, number one, bringing it up and talking about it and finding out exactly from her perspective what she's feeling, and making sure that she understands that it's okay and it's normal, but it doesn't have to be that way. And then exploring the variety of things that could impact that, from her medicines to her emotional well-being to her physical. There are other physical findings that could create that. And then starting to map out solutions. And that begins with an understanding as to how this is impacting her life. I have a lot of women who will come in and say, yes, I have a decreased libido, but it works fine in our relationship. It's not a problem. And I think that's important for women to understand, that they can't look at a website or a magazine and think, oh, well, they're saying this is normal. I'm supposed to be having sex 4 times a week. And that's the baseline. And if I'm not doing that, something's wrong. There's a problem. So I think it's important for women to understand what is normal in many instances is what is normal for you as a couple. And I think that has to be fleshed out. That has to be understood. That's part of that communication. The more you understand whether this is truly a problem or not, that is what drives how aggressive we are in our approach. I've had a number of women who've come in and say, things were wonderful until he got that Viagra. And then after that, it was downhill. So you have to understand where they're coming from and what their individual situation is.
Is there anything you would like to conclude with?
I recently have put together an online course really out of exactly what we've talked about today, the need for women to be educated. I'm not going to replace their doctor, but what I can do with this course is provide answers, provide information that's curated, that's trusted, that really gives them hope. It gives them the power to be able to ask the right questions. It answers a lot of questions. MD doesn't stand for menopause director. We're meant there to be your partner. And that's really what this course is designed to do, is to give answers, but also to allow women to be empowered to ask the right questions, to feel what's normal, what's not. That's where it starts. It starts with the education. Then it goes into the action, the execution. Then we talk about how to evaluate. Are you getting closer to where you need to be? And then you finally go to the evolution. Then you make changes. You're always moving forward. You're always making progress. And this course really is designed to help women do that in a step-by-step fashion. That's very easy. It's very understandable. It's very practical. It really sets the tone for that first step. Learn what you need to do in a safe, effective, and vetted process.
As you said right at the beginning, knowledge and education is power. So that sounds absolutely invaluable. I will put all the details in the show notes and on the website so people know exactly where to find you. Thank you ever so much for your time. I really appreciate it. And everything you've said has just been refreshing and informative and engaging. So I really appreciate your time. Thank you.
Wonderful. And if you feel so moved, I'd love to come back anytime.
Please do. That would be wonderful.
Thank you.
You take care. Thank you.
Bye.
Bye. And if you would like to hear more from Ron, let me know and we can get him back. I know I'd be delighted to talk to him some more. In the meantime, you can find him and his online course on his website, roneaker.com. Please continue to spread the word about the podcast and share it with everyone you know, and leave a review. It is enormously helpful and we are here to make a difference. Thank you so much for listening. I look forward to seeing you in the next episode.